Hello, I'm Dr. Jack Ansell, Chairman of the Department of Medicine at Lenox Hill Hospital in New York City and Professor of Medicine at New York University School of Medicine. I am also Chair of the Medical and Scientific Advisory Board for the National Blood Clot Alliance. The National Blood Clot Alliance is a patient-led advocacy organization dedicated to promoting awareness about deep vein thrombosis, pulmonary embolism, and clotting disorders among both patients and the public. We created this DVD to share important information from a new nationwide survey that we recently conducted. DVT and PE impose a major public health burden in the United States. The Surgeon General's call to action to prevent deep vein thrombosis and pulmonary embolism estimates that each year up to 600,000 individuals are affected by DVT or PE, and that at least 100,000 deaths are due to these diseases. This call to action also points to several patient groups who are at increased risk for DVT-PE, including hospitalized patients, patients with active cancer, and patients who undergo hip and knee replacements. In response to the Surgeon General's call to action, the National Blood Clot Alliance conducted a nationwide survey about DVT-PE among the public and among these at-risk patient groups. Specifically, this DVD will provide you with an overview of our key survey findings about DVT-PE awareness among the general public. It also will provide you with information about DVT-PE awareness and DVT-PE prophylaxis experiences among patients who had hip or knee replacement surgery within 12 months of our sampling. For comparison, it will also reveal results from a survey we conducted among orthopedic surgeons about DVT-PE prophylaxis. The results of this survey are being presented or shared at several important meetings, including, among others, the Society of Hospital Medicine, the National Association of Orthopedic Nurses, the American Society of Clinical Oncology, the American Academy of Family Physicians, and the American Public Health Association. More important information about our survey findings, as well as additional educational tools for healthcare professionals and patients, can be found on our organization's website. We trust you will find this survey information helpful and that it will enable you to join in the efforts of the National Blood Clot Alliance to optimize the awareness and prevention of deep vein thrombosis and pulmonary embolism, and most importantly, to support our efforts to stop the clot. Thank you.
The National Blood Clot Alliance, or NBCA, is a volunteer-based, patient-led advocacy organization dedicated to the prevention and quality treatment of blood clots and clotting disorders. The organization's volunteer governing board consists of individuals directly affected by clotting disorders or blood clots. While the organization is volunteer-based, it remains science-driven. NBCA's Medical and Scientific Advisory Board is made up of physicians, researchers, and other healthcare professionals affiliated with prestigious universities, hospitals, and medical facilities nationwide. NBCA's awareness and advocacy efforts are focused on one singular imperative: to stop the clot. In 2008, the U.S. Surgeon General issued a call to action directly tied to NBCA's mission. This call to action to prevent deep vein thrombosis and pulmonary embolism spotlights the public health impact and urgency associated with DVT and PE, sets forth recommendations for optimal diagnosis, prevention, and treatment, and suggests criteria for research, education, and important policy initiatives in this field. According to the Surgeon General's call to action, up to 600,000 people are affected by blood clots each year, and about 100,000 people in the U.S. die each year as a result. Other data, such as that from the Mayo Clinic, actually show the impact to be greater, with an estimated 900,000 Americans affected and 300,000 annual deaths. In orthopedics, joint replacement surgery is becoming more common. Orthopedic surgeons performed about 520,000 hip replacements and about 581,000 knee replacements in 2006. DVT is widely recognized as a major risk factor facing patients who undergo total hip arthroplasty and total knee arthroplasty, or THA and TKA. Without prophylaxis, up to 80% of orthopedic surgical patients would develop DVT, and 10 to 20% would develop PE. DVT and subsequent PE remain the most common cause for emergency readmission and death following joint replacement. NBCA's DVT-PE Awareness Survey responds to the Surgeon General's call to action benchmarks patient awareness and patient-reported experiences with prophylaxis, and it is a comprehensive study, one of the largest of its kind. Survey questions were developed by NBCA's Survey Steering Committee. This steering committee consisted of several members of NBCA's Medical and Scientific Board, and also several physicians in the fields of orthopedics and hospital medicine. The National Blood Clot Alliance worked with a national survey firm to conduct the survey via online or internet research panels very late in 2009, and conducted all extensive evaluations of all survey findings in 2010. The survey was designed to measure awareness among the general public. Respondents in the national sample included 500 adults in the U.S., 20 years of age or older, 51% female. The exact same awareness survey was conducted among 250 patients who had undergone hip-knee replacement. The hip-knee patients also were surveyed about information provided to them about blood clot risks due to their surgery, their experiences with prophylaxis, issues involving adherence to anticoagulation therapy. For comparison, an online survey of 200 orthopedic surgeons from around the country and who perform hip and knee replacements also was conducted. As with any comprehensive study, in the course of asking questions, the survey results also raised a few questions too. The first one observed was important given the end result. While 97% of surgeons surveyed said they provided DVT risk information to patients, and 80% of patients said they received information from their doctors, that information was not retained. Among the orthopedic patients surveyed, DVT and PE awareness is very low, and the data amplified that hip-knee patients are not significantly more aware than the general public. However, the simple term blood clot does resonate with respondents, most of whom recognize that blood clots can be life-threatening. Among respondents who said they could name DVT signs and symptoms, the national sample showed generally greater recognition, although not statistically significant, than the hip-knee patients in most cases. Among respondents who said they could name PE signs symptoms, the main symptoms mentioned were shortness of breath or difficulty breathing and chest pain. Each mentioned to a significantly greater extent among the national sample than among hip-knee patients. Turning to prophylaxis, when the orthopedic surgeons surveyed were asked which DVT prophylaxis they prefer for their hip and knee patients, their responses confirmed what is largely already known. Despite evidence-based guidelines, DVT PE prevention practices vary widely. The survey also looked at treatment barriers associated with anticoagulation therapies. With regard to Warfarin, more than half of surgeons surveyed said that it is moderately difficult to use. 14% say Warfarin is very difficult to use. On average, 38% of surgeons refrain from using Warfarin, and 18% shorten treatment time with Warfarin due to reported barriers, the most prominent ones cited by physicians being INR monitoring. In this study, 144 patients report Warfarin use. 22% of these hip-knee patients say Warfarin is very or moderately difficult to use. 18% say they needed assistance with the therapy. Despite these opinions, 84% claimed they took the therapy for the full treatment time prescribed, and more than half of those who didn't said they were following doctor's orders. More than half of these patients cite remembering to take the medicine, dosing changes, and dietary restrictions as primary barriers. With regard to low molecular weight heparin, 59% of surgeons said that it is not very difficult to use. 23% say it is not at all difficult to use. On average, 29% of surgeons said they refrain from using low molecular weight heparin, and 16% shortened treatment time due to barriers, which they identify primarily as bleeding and also injection-related. In this study, 116 patients report using low molecular weight heparin injection. 31% of these hip-knee patients say it is moderately or very difficult to use. 35% said they needed assistance with it. Despite these opinions, 91% claimed they took the therapy for the full treatment time prescribed, and the very small number who didn't said they were following doctor's orders. Difficulty with the injections was the primary treatment barrier cited by patients. One final and interesting note about therapeutic use. 97% of surgeons said they provide DVT prophylaxis instructions with discharge orders or a prescription when patients leave the hospital to return home. Conversely, 21% of patients prescribed warfarin and 38% prescribed low molecular weight heparin said they did not receive or do not remember receiving those instructions. The survey instrument also included questions to gauge certain patient preferences. When asked what factors they thought might contribute to a more optimal type of treatment to prevent blood clots, 4 out of 10 patients said, a pill instead of injections, a blood-thinning medication with minimal bleeding complications, a blood-thinning medication with fewer potential drug interactions. When asked how they acquire medical information, the top responses were from their doctor, 84%, from the internet, 71%, nurses, family members, and health advocacy organizations followed behind. When asked about blood clot risk educational materials, most in the group of patients who received them said they were given a brochure or pamphlet. When asked to rate such materials, the majority of these same respondents cited CDs, DVDs, and websites as very useful. In summary, NBCA's survey work identified key areas of concern and important future directions that should be pursued. Risk does not equal awareness. HIPNI patients demonstrate no significantly greater general awareness of DVT or PE than members of the general public. And the survey data actually show that they are less aware of DVT and PE signs and symptoms. The simple term blood clot resonated with all respondents. Disconnects between information provided and information retained leave HIPNI patients uninformed. Prophylaxis practices vary widely and are suboptimal. Therapeutic barriers, things like INR monitoring and bleeding, impact therapeutic use and therapeutic duration among MDs. Despite barriers, patients generally adhere to therapy. In response to these findings, the National Blood Clot Alliance has identified several important interventions that are needed. Patient awareness must be improved. Simplified language should replace technical terms. Targeted education materials for HIPNI patients should be used to improve understanding of blood clot risks and treatment options. Evidence-based prophylaxis should be more effectively utilized. Research into new therapies should be conducted to reduce, if not eliminate, treatment obstacles. By moving forward on a path that is responsive to the Surgeon General's call to action to prevent DVT and PE, healthcare professionals in the field of orthopedics will contribute to improved DVT-PE understanding and prophylaxis, reduced risks and reduced complications, and ultimately, decreased morbidity, mortality, and costs. The realization of this goal is critical to the patients that we serve and can only be achieved through the diligent efforts of key healthcare providers like you. The National Blood Clot Alliance thanks you for your commitment to DVT-PE education and prevention and for your efforts to stop the clot.